All right. Hello, everyone. Welcome to today's coffee chat. Thanks so much for joining us today. My name is Ren Lovegood. My pronouns are they, them, and I am the Senior Manager of the Leadership Excellence Networks here at NCHL. Welcome to our December coffee chat, which will focus on tapping into talent, supporting persons with disabilities through the HR life cycle in partnership with Sodexo. Before we get started, I have a few housekeeping items. First, if you have a question or comment for the panelists, please submit it directly into the Q&A. We are going to try to hold time for questions at the end, but this is a very, very substantial topic. And so if we do not get to your questions, we will follow up offline after today's event. We are recording the session. It will be available on our YouTube channel within 3 business days. Additionally, a link will be sent to all registered attendees after the event. To increase accessibility, we are using Zoom and have enabled closed captioning. Should you wish to enable your own closed captioning during the event, please click on the closed captioning button at the bottom of your Zoom window. NCHL values promoting disability and inclusion through equitable access to our events. So if you do have any feedback on ways in which we could improve, I encourage you to reach out directly to me by email, lens@nchl.org. We will also be sending out a survey for your input after today's coffee chat has ended. A very warm welcome to our panelists. Joining us today are some leaders from Sodexo, including Karen Dutton, Director of DEI, Gloria Puentes, Director of Global Diversity and Inclusion, Lauren Reardon, Director of Guest Services and Service Excellence at Winchester Hospital and Sodexo, and Rhonda Bradley, Human Resources Manager for Sodexo. Sodexo has a really long history of championing equal opportunity for persons with disabilities. In the first part of this 2-part series, we're going to be discussing strategies that leaders can use to increase equity for persons with disabilities in the HR life cycle. We're going to focus today specifically on those early stages of hiring. So that could include pre-recruitment, addressing stigma or bias in the candidate selection process, and creating a culture of belonging. 25% of the population in the US lives with a disability, likely more than that, but statistics vary a little bit. And this makes people with disabilities one of our largest, if not our largest, minority group, and a substantial opportunity for sourcing talent. Often we find that persons with disabilities are at a disadvantage before they even reach the onboarding or hiring stage of employment. And we welcome you to share your own strategies for recruitment and hiring inclusion in our Q&A through today's event. We're going to start with Rhonda. I know that you often work with partner organizations in the early stages of recruitment. I'm really interested in what challenges you've witnessed when working with organizational partners who are trying to identify and address equity challenges in hiring for individuals with disabilities. Can you tell me a little more about what barriers you've identified at those early stages of the talent life cycle?
Absolutely, man. First, I would say thank you for inviting me and having me a part of this chat. I'm very excited. The greatest barrier, and perhaps I would say the most pernicious barrier that I've seen in the early stages of the talent life cycle has been the barrier of fear and that ableism that fuels it. You know, a lot of times, you know, although we have ADA and policies in place, our system places values on what's normal, what's productive. And too many times disabled individuals are not allowed the opportunity to actually get an opportunity to work in these particular places because of the way that managers may see them or think, oh, do I have the physical environment to be able to handle that? Or am I going to say the wrong thing? What's going to happen next? So there are some things that are out there and many things that we've been talking about as well that we have been able to put in place and to do to help take away that fear. So for me, what I've seen that all of these things come around are surrounded by fear, you know, the communication, the technical support. Am I going to be able to actually accommodate that person as well? So that is what I've actually seen. The biggest thing has been that area around fear.
Thanks for sharing that, Rhonda. And Karen, so I know we just spoke a little bit about fear. Could you give me an example of how fear maybe has impacted or might impact unconscious bias in hiring managers, or an example of where you've seen this and how organizations can overcome that fear of the unknown when it comes to hiring individuals with disabilities?
So I'll give a quick example on a college graduate who had a really impressive background in college. And I met with this individual right after graduation because he was looking to join our organization. And he immediately informed me that he had a stutter, and I smiled and said, well, I promise not to interrupt, because that's what I do, is I interrupt people regardless. So we had a brilliant conversation. So I went to 2 hiring managers, both of them were executives, so vice president level. And the first one did a phone screen, a phone interview, and came back to me and said, absolutely, he has terrible communication skills. I cannot hire this individual. I went to another VP because it was a new program that we were launching, and we were looking for managers in trainings to start their early career with the organization. He didn't even notice that there was a stutter in the conversation and recognized that this individual, this candidate, was brilliant. Subsequently hired him, and through the next 18 months to 2 years, this individual was promoted 3 times. So it's just an example, and it's the mindset. It's the mindset. It's getting over what Rhonda said, that fear, or you have something from those preconceived ideas or these biases that you grew up with or you were surrounded with, thinking that this person, and I was sharing earlier that changing the narrative from, if someone has a disability, it doesn't mean they're disabled. Because if you listen to what their needs are, this is where the equity piece comes in. If you listen to what the needs are, then they'll be successful, like everyone that you want on your team to be successful. So it's making sure that you have the right job profiles in, that you help raise awareness for your managers, that you have the support for your managers on how they can ask the right questions, right? Even pre-interview, do you have the right questions so that you're bringing the best out of that candidate and what they truly can bring to your organization? So it's just a quick hit, just a quick example therein.
That's a great example, Karen. Thanks for sharing that. And
if I can just add one other thing too,
of
and
course.
I like, we all like to talk, right? But it's also, you think about people with glasses. So I have a vision impairment. I can't drive unless I have my glasses on. Matter of fact, if I get pulled over by a police officer and I'm not wearing my glasses, I'm going to get arrested because it says in my license I have this visual impairment. But over the years, we don't look at someone who wears glasses and think, oh my goodness, they have a disability, because it's acceptable and it's normalized. We have a corrective action that takes place. I think we need to look at that same mindset when we are hiring talent for the positions that we have. So
that's another really great example. Thanks so much, Karen. And Lauren, I'd love to hear your perspective on how we can increase equity in those early stages of recruitment and hiring to increase those opportunities for individuals with disabilities. I know you work specifically in healthcare as well, so I'd love to hear about what some of those unique challenges might be from your perspective.
Sure. Thank you, Ren, and good morning, everyone. I work in a small community hospital, part of a large health system, just about 10 minutes north of Boston, for Sodexo. And in my support services departments, specifically food services and environmental services, we do have several employees hired with disabilities. And I would say in the early stages, it's about making sure your organization that you work with supports this, as well as your executive team. And then it can kind of trickle down to your managers. And it is really about having conversations with the team, being open-minded, and having support for not only the employees that you're going to hire, but your managers, and how to support these individuals and really meeting them where they're at. So we want to work with them and we want to work to their strengths. And when you do that, it is very rewarding, not only for that individual, I would say for a leader, it's extremely rewarding. And then for the rest of your team, because once you do it and you're comfortable with it and people see how well it works, and then they're willing to try and take on more employees and support them it's great for the entire organization. So we've opened a lot of people's minds and hearts by doing that over the years. Thanks.
That's amazing. So I know, Gloria, you work often with community partners too, so external from Sodexo to support and source talent. I'm wondering how these partnerships have helped you to increase equity. Is partnering with these external organizations a way that you can help to provide opportunities and get those people in the door, even for interviews or for pre-recruitment?
Yeah, absolutely. First, I want to say thank you, Ren, and to NCHL for inviting me to be a part of this panel. This is a topic that is near and dear to my heart. Not only I have the great privilege of leading our external strategic partnerships here at Sodexo, and it ranges for all dimensions of diversity. But I will share with you that in 2018, we launched the Sodexo Workforce Initiative. That's working with organizations that are providing job readiness and or workforce development to the communities that they serve. Now, they serve all dimensions of diversity, but for the sake of today's conversation, I will talk about those organizations that serve individuals with disabilities. And in fact, of all of the partners in the Workforce Initiative, the largest percentage of partners are serving individuals with disabilities. And these are, as both Lauren and Karen and Rhonda all mentioned, these are individuals who are often marginalized and overlooked for positions. And I had a number of Sodexo colleagues who have said, well, okay, I'll try one. And they bring on one, and before you know it, they're adding 2, 3, 4. And there are sites that have up to, half their staff are individuals with disabilities, and all levels of disabilities, because they are focused on the abilities, as Karen mentioned, of those individuals. So it is wonderful that our colleagues are opening up to the individuals with disabilities and realizing that whether they live with autism or any type of neurodiversity or even visually and hearing impaired, that there are places within Sodexo where they can join us and thrive within our organization. You also mentioned about intersectionality, and as we all know, not one individual is, has just one dimension to them. We are all have many different dimensions, and especially when it comes to disabilities. Some are born with, who are have a disability, but many of us have, we become have gained some type of a disability throughout our journey of life. And so there are so many intersections, and some show it, some don't, and it's okay, but we bring them in and really welcome them into Sodexo.
So Ren, I just wanted to add to what Gloria was saying there, and I think it was a really important point, is that, and so did Lauren, everyone's mentioned this, is around the leadership and being able to have that psychological safety within your organization to encourage self-identification. And I think that it's a challenge because people feel if I identify, then I'm going to be looked at differently, right? And I think it's really important if we can have our leaders embrace the idea and say, hey, I'm Karen Dutton, I'm a vice president, and I live with this, right? Whatever that might be. It's opening that door to say for someone else to say, hey, I am living with this and I belong. Goes in what Gloria was saying and Lauren, is that belonging piece, and just making, because the reality is 61 million people, give or take, right, in the United States, adults are living with a disability. They are a large consumer base. They are large consumers of healthcare. They want to go into healthcare operations and see people who are like them, right, who are it's okay to be like them and they belong. So I think that we've got a ways to go to be able to get people comfortable, and especially that senior leadership modeling what we want them to do with self-identification.
And Karen, and also if I can add this, one of the conversations that we had previously was we looked at women being in different areas, and I brought up the fact of being a female in the manufacturing area, and females aren't supposed to be able to know how to handle a tool or do these things as well. And look now, it's very normal. So when we bring in applicants and when we're talking to them as well, I think our leadership team is now, more acceptive of things that people can do. For example, we just had a job fair and we've hired individuals in the utility. And we had an individual also in another area that was hearing impaired. And the question came up, well, how will we be able to do orientation? Well, guess what? We have So there are so many things that you can, use your video captioning and the orientation at bringing that awareness. And like we said earlier, even some of the employees, how can I do sign language, the engagement piece of it. So there are so many other areas and things that we can bring about to help bring awareness to individuals of disabilities that, make a difference for us and to help support them. So as we all have said, just overcoming that fear and knowing there are ways that we can overcome that fear.
Gloria, go ahead.
Yes, Ren, I wanted to also share a great example. We recently had an individual who was a candidate who was called upon and scheduled for an interview. Well, the agency called me because this agency focuses on individuals who live with autism. And he said, Gloria, this is a phone interview. This candidate will never get through the phone interview. So I said, not a problem. And we have an applicant referral form through the Workforce Initiative where they can note all of the specifics that we should be aware of ahead of time. So I contacted the senior recruiter and told her about this individual. And so she said, not a problem. I connected her with the agency. They got prepared and talked so that the individual was able to go through a successful interviewing process. So those are the types of things that we do here at Sodexo to make sure that people are really being able to get through, even from the onset of an interview, get through the process in an accommodating way.
And Lauren, you said that you had someone who's been on board for a really long time. I can't remember the number of years.
I do. I have one gentleman who has been on board. He'll be celebrating his 50 years in February.
Did you say 50?
50. 50, yep. And I have another individual with autism who will be here 22 years. So really, and we work with his agency as well, and have since spoken at events, and it's just amazing what how rewarding it is, not only for these individuals, but for their families, for fellow members of their groups and staff members. And we have let them come in for tours to look at other job opportunities. To your point, Gloria, on a frontline level, they don't go online and apply for these jobs. So we work with our internal human resources partners at our organization to, have just an on-site event so that people, we can meet them and do things non-traditionally. And similarly, you can get through, I think sometimes folks get hung up in, we're so busy and how are we going to accommodate this? And we have all these mandatory trainings. And how is this even going to happen? So, all the mandatory online trainings, you can sit down and do it one-on-one with these individuals. And there are resources out there to support. You just have to cross over, take one step, and then it becomes easier. The path is easy.
So Lauren, thank you for that. In fact, our the agencies that we work with are all eager to come in and provide assistance, support, training to our managers and their teams. We also have many of our agencies provide job coaches to the individuals for the first several months when they become gainfully employed. So there are so many resources out there that we absolutely provide to our managers here at Sodexo as they bring new staff on.
Hey, Brian, I don't know if you
Yeah.
received my note yet or not, but I had someone that wants to come off of mute, Alton Scott, to make a comment.
So I'm not able to take them off of mute just in the webinar, but we can put comments into Q&A. I know there's one person who just said that they have been able to hire 2 individuals over the past year with disabilities, and it's working out very well. There's been a lot of support from clients and staff. So that's excellent news. I'd love to hear that. I will share. So I am legally blind. So when I'm reading on my website, I have a lot of different things that I use to accommodate myself. And as my vision impairment has developed as I've gotten older, something I found really interesting are just some of the statistics around employment for people who are legally blind. I think it's 70% of legally blind or blind individuals are unemployed. And it's been really interesting for me in that hiring process, sometimes looking through different websites that maybe don't link to accommodation software. I'm wondering if there's been any initiatives Sodexo has helped with to look at, website access for individuals with disabilities, whether or not things are linking to platforms that help for access, considering job descriptions, right? I've seen job descriptions in the past where it's maybe a desk job, an administrative job, you're answering phones, but it says you have to lift 100 pounds or be able to stand on your feet all day. And maybe that's not a requirement you really need and it got stuck in there by mistake, but I'm wondering, are there other strategies people are using in Sodexo or in partnership with some of your organizations that you work with to look at some of those barriers that maybe are in there by accident, but are potentially preventing individuals from even being able to apply or get their foot in the door?
So Gloria, I didn't know if you were going to jump in here, so I'll jump in. It's that accessibility piece is huge for us, Ren, is really making sure that when we're communication, whether it's to our official comms team or what we're doing, that we're pulling apart job descriptions from frontline level all the way up to managers and senior executives. It's like, what are they saying? And what are the profiles behind it? Are these things that are really necessary? And I was on a task force that we were looking at some of the frontline position position profiles. And it was language, to your point, that was like 40 or 50 years old, not even it applies to what we're doing today. So I think as we have more heightened awareness about this, the more you'll see that intentionality of like asking the questions, how is this, is it the whole equality piece, right? But the equity piece. So.
And thanks, Karen. I'm going to add on to that. It's interesting that you asked that, Ren, because we do, when a unit comes to me, a general manager or hiring in-unit manager comes to me and says, Gloria, we have a need for XYZ, so many number of employees. We know what the talent on the war on talent is today. And so the Workforce Initiative is a great initiative and a great program to bring in a diverse group of candidates. And so for me, it's about asking those specific questions. Well, what is really required to come in? And then not only that, but we then take, now that things are clearing up from COVID, pre-COVID, and just more recently, we are starting to do on-site visits when they call and say, we have a need for 20 new employees. Then I want to take the agencies to the site so that they can visually see what the site is like. Depending on who they are serving, it's going to be important for them to see, is that environment going to be conducive to the candidates that I forward to Sodexo. Now, we have vetted all these partners, and they in turn vet the candidates for us prior to them sending the candidates to us. So we ask those specific questions. Is everything that is on this job description, is it really required? And those are the ways that we accommodate what is being asked of our employees.
And Brian, if I can add, just to piggyback off what Gloria said, that's exactly the way that we do in Houston as well. And having those on-site visits, actually having the agency there gives them the opportunity to visually see what the locations and what the sites look like as well. In addition to that, we often invite the agencies, and they do, to come back for visits 30, 45 days later, and they actually sit down with some of our general managers to see how things are going, you know, what changes or just what needs to go on. So they are very engaged in that. That has been such a great opportunity for us in our healthcare, with having that relationship with the agencies, because what happens is the general managers then say, wow, you know, they have some buy-in. I have someone that I can connect to as well. So we found that to be very, very useful and helpful for us here in Houston.
Thanks, Rhonda. I'd like to say one more thing in alignment with what Rhonda is saying, is that a number of the partner organizations are saying, hey, Gloria, if you have an internship, or if there is some way that we'll go ahead and accommodate the, you know, by even paying their salary for the first, you know, 10, 12 weeks, if that will help for the manager to feel more comfortable with bringing them on as a full-time employee. I personally prefer not to do that, because I want our managers to be committed from the onset. We'll help you to bring them in and make sure that they are fit into your workforce and meeting your needs. But we really want to show our commitment from the onset. So, but we are here to support our operators as well as the organizations that we work with.
I'm wondering, oh, sorry, Karen.
I know that Rhonda said that Alton wanted to come off mute. So you in fact were able to disable that function. So I don't know if Alton's still out there, that he wanted to express his idea. Okay. Go ahead, Rhonda, I'm sorry.
Oh, sure. So we have just a note in the Q&A saying from Jose Vargas that they've been able to hire a deaf employee for about 6 months. It's been a great employee. They did start working with an agency to try to bring in additional employees with disabilities. And one just started yesterday with a job coach. So recognizing we only have a couple minutes left, I think these external partnerships are really great, because often they don't cost anything to the organization, right? So they're bringing in resources, supplementing resources to help support these individuals with disabilities who are being hired in a way that, you know, right now healthcare is really strange financially. We are working with resources that are spread pretty thin. And so these partnerships might be a really great way to be able to supplement training and support and accommodations. And I'm interested in if there are additional comments you'd like to make about those partnerships in particular, or the accommodations process in the last couple minutes we have.
I would just like to say that, you know, these partners are so eager to provide us with candidates. And if there's any hesitation, reach out to us, you know, and I will connect you with, now we don't have partners, we have partners in all 50 states, but it may not be, especially in the rural areas. But if you have partners out there that you would like us to vet for you, absolutely, we're more than happy to do that. But the partnerships that we have are so amazing and they're so eager to work with employers to get their the constituents that they serve gainfully employed. So open yourself up, open up your mind, your heart to individuals with disabilities, to being on your team. I know you won't regret it.
So Gloria, I just want to add here, because we may have individuals that are participating in the call today that are not part of Sodexo. So if they had a question on how to even begin to establish a relationship or vet a partner, can they reach out to you? Would you be able to?
Absolutely. Absolutely. Because I will see where they are. And if we know of an agency, an organization within their area, I'll connect them with them.
Excellent.
I would just add, some of these agencies, I know prior to COVID, we created a little class and they took it back to their organization and their agency just to see how some of their individuals worked with and would they be a good candidate to put forward. So that's another thing. And then the last thing I would say is be open to different hours as well. I think that is something for us in healthcare. I know I'm trying to adjust to it. But there are individuals out there, but maybe they don't fit in the standard role or they can't work certain shifts, but they can provide a valuable resource for us all.
And Lauren, if I may just add to that, maybe you want, you think you have a need for 3 full-time people. Consider bringing on 6 part-time people.
Exactly.
And seeing it that way, because sometimes individuals with disabilities will only work 4 hours or 6 hours and not a full 8 hours. So be open to change like that to accommodate.
Exactly. And that gets back to meeting them where they're at so that they can be the most successful in these jobs.
It takes a little creativity, but it's definitely something that we can do. And I think it makes all of our teams stronger to have multiple perspectives and experiences and individuals joining the team who are able to contribute in very unique ways. Thank you all for joining us. I'm going to end with, we did have someone who was trying to speak out. I'm sorry that I wasn't able to take you off mute, Alton, but what he said was that he wanted to comment and respond to Gloria's comment saying, let's try it, that this was their motto in a prior work life. And one of the employees that he had hired had a visual impairment, and with accommodations that cost less than $200, he just celebrated his 10-year anniversary. So he said it's, that's, I think, a great way to end, is saying, I think a lot of people aren't well versed on accommodations. They haven't asked for them. Most accommodations cost nothing, and the majority of accommodations that do incur some sort of cost less than $500. So it's a pretty minimal investment to be able to support and add to your team with individuals who are going to be hardworking, loyal, and really be able to add to the culture of your organization. And so I hope that you all will join us on January 19th to talk more about strategies through the next steps of the talent HR cycle, looking at hiring, onboarding, and retention. So thank you all so much for joining us today. I hope you all have a beautiful holiday season. Take care of yourselves, and we will see you soon.
Thank you.
Thank you.
Bye.